So my name's Andrew, or Drew. I work for Linked Sexual Health as the LGBT plus lead, but also the events officer for LGBTQ plus Allies and Staff Network. So I presented this LGBT plus History Month presentation to the Grand Round just at the beginning of February. But I thought it'd be a great opportunity for the whole of Bedfordshire Hospital staff to be able to access this if they wanted to. So I'm doing this today. So I think with LGBT history, I think it's really important to kind of look at kind of where we've come from, but also to look at where we're at now. But what I want to really focus on with this presentation is looking towards the future. So what can we do as a trust? How can we support our colleagues, our patients, our visitors, to make sure that when they access the services that they feel safe, that they'll feel respected, they'll feel listened to. So I'll talk a little bit more about my role with LSH and the staff networks, but I want to talk to you a little bit about the importance of LGBT History Month, and hopefully we'll have a video that we can play that will just demonstrate that. So this is kind of the aim of LGBT History Month. So sometimes when we do a lot of stuff around LGBT+, a lot of people can be quite negative towards it. So they might think that what we're trying to do is kind of put LGBT+ on a pedestal, or we're trying to provide LGBT+ people with extra rights and all those sorts of things. But really what LGBT History Month is about creating a sense of equality, inclusion, diversity, but also making sure that everyone's got the same opportunity in employment, in education. So it's about looking at things sort of culturally, socially, looking at people's histories, people's lives, and just making sure that we remember that we reflect that, and that we input LGBT+ into the kind of work that we do. So every month, LGBT History Month has a theme. So this theme for this year is Medicine Under the Scope. So its aim is to celebrate the lives and work of LGBTQ+ healthcare professionals who have a significant contribution to the field of medicine. So this is past, but also present. It's thinking about the situation like we had during COVID. And that's not to say that people in medicine who are not LGBT+ don't do a great job. But it's just to try and celebrate those people that work in medicine that are LGBT+ as well, and just making sure that we recognise their contributions as well. So I'm going to come out of that. I'm going to have to go into a different. Let's have a look. So I think we're having problems with sound. So this video does have captions, so sound isn't that important. So just want you to have just look for some of the history for LGBT+ in the UK. Okay, so I mean, historically, sorry, there's someone on meeting G that they could just put that on mute for me. Lovely, thank you. So yeah, historically, LGBT plus people have had quite a negative history, quite oppressive, quite a lot of discrimination. Obviously, towards the end of the video, we get quite positive things. So the age of consent has been lowered to 16 for anyone that's sexually active in the UK. Same-sex couples can adopt, same-sex couples can get married. There have been things recently, such as Section 28, which have impacted particularly on gay and bisexual people, so not being allowed to be discussed in schools as part of that. And unfortunately, today we still see inequality, and sort of negative things happening. So particularly, there's still the idea that there's this trans conversion therapy that they're still trying to pass through as a bill. So LGBT plus people, although our history has got better and we're striving for equality and equal opportunity, we still face discrimination. So there's still a fight that we need to fight. There's still advocacy that we need to continue. And that's why History Month is really important, because although, you know, our history and legislation's improved probably over the last sort of 20 to 30 years, we know that there's still negative attitudes towards people that are LGBT plus. LGBT plus people on TV and in films are still being portrayed in old stereotypes and those sorts of things. So any History Month is always about reflection, but it's also really important to kind of look towards the future. My role within the LGBTQ plus and Allied Staff Network is the events officer. So you may have seen me and some of my colleagues maybe around the hospitals promoting things like LGBT History Month, Trans Awareness Month, those sorts of things. So anyone can join the network. You don't have to be LGBTQ plus. You can be an ally. You can have family or friends that might identify as LGBTQ plus that you may want to sort of join. So it's really a safe place to open up about things, for support, to talk to us about things that you might be experiencing that we can maybe talk to people about to try and improve situations. At the moment, we're looking for 2 co-chairs. So if you're interested in that, I've got my contact details at the end of the presentation. Contact me. We can sort of talk you through the role a little bit more about what that is. But it's a really good network to be part of. So if anybody would like to join that, I'll talk about that towards the end. So really importantly, recently the network undertook the NHS Rainbow Badge Programme assessment. So this is a national thing that the NHS do, and it's something that we recently completed as a network. So really the aim of this Rainbow Badge assessment is to reduce the key barriers that LGBTQ plus people might face when it comes to healthcare. So not just necessarily hospitals, but maybe accessing doctors and community-based healthcare services. And as I said, really importantly, to ensure all staff, patients and visitors feel safe while accessing Bedfordshire hospital sites. And also a really good opportunity to share good practice. So we know that across the UK, there's some really good stuff going on as part of this Rainbow Badge assessment. So it was an opportunity for us to look at good practice and to take some ideas on board. So as a trust, we undertook the Rainbow Badge scheme between March and July of last year. So that involved looking at our policies and reviewing them. A lot of you may have been involved in the patient and staff surveys, so just kind of asking you questions about your experience of working for the trust and also being a patient for the trust in terms of our LGBT plus approach. There was service surveys, so each service, so particular services around the hospital will ask to input data regarding to LGBT inclusivity. And then we also had workforce assessment. So it's quite a large piece of work that we completed. So in August, we got our results back. So we were graded at an initial assessment stage, which was really good. So what it shows us is we're doing a lot of really good work within the trust to make sure that LGBT plus people, staff, colleagues and visitors feel included, and that the services we provide are inclusive. And of course, with any service, there are recommendations that we were given to increase our grading. So obviously what we'd like to do as part of this is to go from initial assessment up to bronze. And we were really, really close to getting that bronze award. So as a network and as a trust, we will be looking at ways in which we can increase that grading to get bronze. Okay, so it's an ongoing piece of work that we'll be doing. But some really good stuff going on within the hospital. So it was really pleasing to see some of the feedback that we'd got as part of that process. So again, if you'd like to join the network, you can be part of sort of improving our NHS Rainbow Badge grading. So it's a really important piece of work. So what we know really from sort of surveying LGBT plus people, these are some of the barriers that they present. So there's quite a lot of fear about healthcare professionals not understanding someone's gender identity or sexuality, and that may impact on the care that's given. It may impact on remarks by healthcare staff, so negative comments made by healthcare staff. Professionals asking inappropriate questions, so particularly with our trans plus patients, you know, professionals are asking them questions like, have you had the operation, or what genitalia do you have, or how do you have sex? So really inappropriate questions that probably don't need to be asked based on the care that they're getting. We do find that there's quite a lot of outdated attitudes and approaches, particularly to someone living with HIV and how HIV is transmitted and the care that people may get as a result of having HIV. We know that some people, particularly young people, are homeless, so it's quite hard to access healthcare services. And particularly with our trans plus patients, so being misgendered, so using the wrong pronouns, not using the preferred name that somebody wants to use. So these are all things that prevent LGBT plus people from accessing healthcare. So part of the Rainbow Badge assessment is to try and look at some of these barriers and to try and improve access for people, and also to make people feel really comfortable when they come into a service. Okay, so there may be times where you do need to ask questions about maybe what genitals somebody has. So particularly in sexual health, we would. So there are times where you can ask questions like that. On the whole, most of the experiences of LGBT plus people are quite negative. Okay. So from the staff survey, in terms of identifying gender, we found that 7.55% of, so this should be patients, sorry, that says, no, this should be staff, so it says patients on the other side. Sorry, so 7.55% of staff identified either as trans, non-binary, or identified in a different way, and 7.81% of patients identified as trans, non-binary, or identify in a different way. So although these numbers are quite small compared to the rest of the population, we know that the people that we work with in the trust and people that we care for in the trust will identify as trans, non-binary, or something different. So we know that we will be working or have contact with people that might be trans and non-binary, okay? With sexual orientation, so much higher percentages, so 27.92% identified as either lesbian, gay, or bisexual, and then nearly 36% of patients identified as lesbian, gay, or bisexual. So again, we'll be working, a lot of our colleagues will be LGB, and a lot of our patients will be LGB. So that was really useful data for us to gather, because it's evidence that a lot of people that we have day-to-day contact with will identify as LGBT plus. Okay, so we just need to be wary that we will be working with people. So we may need to think about the way that we approach their care, the questions we might ask, and those sorts of things. So Luton Sexual Health, I suppose, as a service or as a sort of a department in Bedfordshire Hospital, should be one of the best services in terms of LGBT plus inclusivity. I'd like to think that we do a really good job here around that, but obviously no service is perfect, so there are things that we would need to improve on. But I just want you in your departments to think, how would someone that might access the Bedfordshire Hospital's website or the individual department website know that it's LGBT plus inclusive? So what we have on our website, so that first paragraph is really powerful. So it's to make sure that people know we're inclusive and a sex positive service. So it means being able to explore your sexuality or gender identity safely, so that that person can make informed choices about the relationship, sex they have, talk about consent and make sure they're having pleasure, okay? And also important to say we provide a safe, confidential and non-judgmental environment, okay? So anyone LGBT accessing our website hopefully will read that and think, actually, Luton Sexual Health is an inclusive service, and when I go there, I should be treated with respect, and I won't be asked any inappropriate questions. So as a sexual health service, it's really important for us to make sure that people know that, okay? We also have on our website a list of services that are included, particularly for LGBT plus people, so they know exactly what we provide, and that they are accessible. So testing, treatment, contraception, particularly for what we call GBMSM, so gay, bisexual, men who have sex with men, hepatitis A and B vaccinations, HPV vaccinations. We also do assessment for PEP, so post-exposure prophylactic. So it's a course of medication you can take after you may be exposed to HIV. Assessment for PrEP, which is pre-exposure, so medication you can take before you have sex, and they help reduce the risk of HIV. So it's not just GBMSM that we provide that for. We may provide that for high-risk clients, so male and female sex workers, and also trans and non-binary clients. We support trans men who may have periods, so that although they identify as male, they still may be having periods, so we can support around that. We provide cervical cancer screening for trans men as well, so we know that it may be embarrassing or difficult to go to their GP for that. And we also support people who may engage in what we call chemsex, so people that might use drugs when they're having sex, okay? So clinically, we outline everything that we provide for LGBT clients. But it's also important to say that we have an outreach team as well. So part of my role as the LGBT plus lead is to provide a safe space to explore sexual orientation, gender identity, looking at how people can come out and how to do this safely, talking about the different levels of transitioning that people might want to experience, support around mental health, how to develop healthy relationships, and also support around stigma and discrimination. And it's also important on our website that we've also got my details on the website, so they know that there is an LGBT plus lead or a person they can contact directly if they want to speak to. So I know that not every department in the trust is going to have like an LGBT plus champion or someone responsible. Even if you put my contact details on that section of the website, I'm more than happy to speak to anybody, staff, visitors, patients who might need support around LGBT plus. What we'd probably like is for most departments to have a representation of the network so that they can go back to their departments and feedback things and look at how they can improve some of their services. But I know that's not always possible. So we just want to make sure that when they access the website, they know it's inclusive, they know there's services for them, and that there's someone there that will understand and support them through some of these processes as well. So again, for us as a service, it's really, because we're talking about sexual health and we're talking about biology and we're talking about parts of the body that you may use for sex, it's appropriate for us to be asking questions around that, okay? So we might ask questions like, what is the gender of the person you're having sex with, or what is the gender of your partner, rather than saying, if a cis male comes in, just assuming they're heterosexual and assuming they have a girlfriend. So if we ask questions like, what is the gender of your partner or the person you're having sex with, that allows them to answer the question. And then we can document that in the notes to make sure that we know that that's the gender of the person they're having sex with. Also, it's probably appropriate for us to ask what types of sex they're having. So what parts of your body are you using for sex? Because it will allow us to determine what tests are relevant and appropriate. So again, once we've asked those questions, we can document that in the notes so that we don't have to ask those sorts of questions again, okay? So what we're thinking about here is inclusive language. So like I said, so asking what is the gender of your partner rather than assuming, or what types of sex are you having? So for example, you might have a gay man that comes in and we could assume that he's having anal sex because he's gay, but in reality he's not. He might just be having oral sex. So it's really important that we ask those questions and allow our patients or clients to answer those and then document that. Also, in terms of inclusive language, we're changing the way that we, what phrases or words we use. So again, instead of saying someone, so if someone has a vagina, we would say they would need to provide a swab, rather than saying that women need to provide a vaginal swab, because if you're a trans woman that was born with a penis, you don't have a vagina, okay? So again, we could offend people and not be inclusive. So anyone that has a vagina will do a vaginal swab, and anyone that has a penis will provide a urine sample, rather than saying men need to provide a urine sample, okay? So I guess in your departments, it's kind of thinking, how can you change the words or the language you use to make it inclusive? So obviously your services might not relate to sexual health, but it's again thinking, how can we change words to be universal and to be inclusive? And I don't mind supporting you with that process if that needs to be done. So it's a very easy process for us at Sexual Health, but it may not be necessarily an easy process for other departments. Also, some people may come with someone to their appointment. So again, it's about not assuming who that person might be if they come in. So this person could be a husband, it could be the partner, it could be a brother, it could be a father, it could be a friend. And this woman could potentially be a wife, a partner, a sister, a mother, a friend, or a surrogate, okay? So maybe from the outside in, we might think, oh, that's husband and wife. Husband has come to support wife with a scan. But in reality, that male may be someone completely different, and that female be completely different. So what, again, we would ask people is, who have you come with today? Who have you brought with you today? And will they be attending with you often? So again, it could be that a young person comes in with a male person and we might assume that's their boyfriend, but it could be a friend, it could be their brother. So it's really important that we ask those questions to make sure that we are inclusive and not making assumptions about things as well. So we will document in notes, person came in with their brother might come in with them regularly, or person came in with mum came regularly. So this scenario on the screen is probably maternity. I know maternity are really good with documentations and things, but it's really important that you ask those questions, okay? So you can document, so if that is brother coming with sister rather than husband, you can write in the notes, brother will accompany client or patient regularly. So if it's in the notes, it's easy to read, and it just makes people feel more inclusive if you ask them the question rather than just assuming. So I know a lot of services outside the hospital do that, and a lot of LGBT plus people, or anyone really, just get quite offended by assuming that person is someone that they're not. So documentation in notes if possible, and just ask those questions to make it more inclusive, okay? So that's really important. So also what's really important is that obviously we have legislation that we work to and adhere to. So the Equality Act of 2010 has those 9 protected characteristics, which gender reassignment and sex and sexual orientation are part of. So it's just making sure that we familiarise ourselves with that policy, making sure that everyone that comes in, we treat equally and fairly based on those characteristics. The really important thing to say about LGBT plus as well is that everyone can have their own opinion on really any of those 9 protected characteristics. But obviously, when you come into work, we have to put those aside and we have to sort of work within the realms of legislation. So absolutely, everyone's entitled to their own opinions about all these 9 protected characteristics. So obviously at work, we need to make sure that we give our patients the best care that we can. Okay, so I believe that document is on the website. And it also talks about how to support with discrimination and reporting discrimination and those sorts of things as well. Okay. So we're looking at kind of the future, but what's really important to kind of look at is what can we do now as a trust in the short term to make sure that our services are LGBT plus inclusive. So really important that we encourage reporting of what we call homophobic, transphobic, and biphobic discrimination, and to improve these procedures. So your first port of call may be your line manager. You've also got the Freedom to Speak Up team that you can talk to. So even if it's not aimed at you, if you hear it, it's really important to report that. It shows people that we're not tolerating those sorts of that sort of language or those sorts of discrimination. And unfortunately, we know that discrimination still exists within quite a lot of professional businesses, settings, and those sorts of things. Okay, so that is to make sure that when someone comes to work, that they feel safe. Like I said, think about the words we use or how we could phrase things slightly differently to be more inclusive, which isn't always easy, I know, because we're used to kind of using words and phrases, but just changing the words and phrases we use goes a really long way, and it really helps with inclusion. So display information promoting LGBTQ plus support services, support people to access these services, so maybe provide, a number or email address. And I think we need to provide more inclusive imagery around the hospital and departments. So promotion of LGBTQ plus services isn't necessarily about decorating your area with rainbows and rainbow flags. It's just having something on the wall that someone can look at and think, this service is LGBTQ plus inclusive because there's imagery on the wall, there's information about support services. So you don't have to do massive amounts really for this part. It's just having posters or having some information of local services that you can give to people if they request it. And that's also really helpful for people as well. As I said, familiarise ourselves with our policies, make sure that we're adhering to the policies, and look at our responsibility for duty of care. And also promote confidentiality. So, we work in a very diverse town. And some people find it slightly more difficult to come out. Some people find it slightly more difficult to live their lives as an LGBT plus person. So just talk about confidentiality with patients, make sure that they feel safe whilst they're in hospital, and that information isn't going to be shared publicly, but only within the team to make sure that people are aware of those sorts of things. Okay. So some examples of inclusivity that we've got. So on email, we've got adding our pronouns to our email. It's really important to say that pronouns are universal. So they're not just for trans or non-binary people. So everyone has a pronoun that they can use. So they can add it to their email signature. So again, you might have an email from someone called Chris, and your brain might think, well, that possibly might be a male because Chris is predominantly more of a male name. But it could be someone called Christine that just shortens their name to Chris. So by having that pronoun there, it just allows the person that you're engaging with to know what to use and what to expect. We have our Thrive initiative that we use. So particularly the H, the R, and the I. So the honest and openness, respect, inclusivity, and the value in people is a really important part of our day-to-day ethos. Having a name badge with your name, your job title, and again, your pronouns. So it's very clear what your name is, what your preferred name is, and what pronouns you'd like to use. And obviously we have our no excuse for abuse posters. So if you haven't got one in your department, definitely worth putting one up, just to make sure that anyone that comes into that department knows that any sort of abuse or discrimination isn't tolerated. Okay. And that everyone at work is there to support you and to do their job. So regardless of their gender or sexuality, people that are employed by the trust are skilled, compassionate, professional, and that would not impact on the care they give someone just because they might be gay or transgender or non-binary. Okay, so it's really important to say that the person that is caring for you today is trained and will be able to provide that for you. Okay, so when I've done the ground round, we had an example where somebody, I think, didn't want to be seen by a certain member of staff for a particular characteristic. So it's really important to say, actually, today this is the person providing your care, and there is nobody else to do that today. So this is the person that's going to support you, provide your care, and that's one way that we can kind of sort of knock that sort of conversation down. Also, some more examples. So imagery. So same-sex couples who are parents, particularly maybe around maternity. So 2 men having a baby, 2 women having a baby, those sorts of things. And then just above there, so different types of relationships, so different types of gender, ethnicity, sexuality, just making sure that that's inclusive. And it is really important for people when they go into services to see an image of themselves, I suppose. So for me, if I was walking through the hospital as a gay person, that image of 2 men having a baby would make me think, okay, that's great. This is inclusive because it's showing 2 men as parents or 2 women as parents. So it's really good for people to come in and see themselves reflected, either in imagery or from having posters and those sorts of things. So that does really help people feel at ease when they walk into a service. So part of my role, both as sort of LSH and events officers, to do a lot of promotion around LGBTQ plus Awareness Day. So we are coming towards the end of LGBT History Month, but we've got all those other things that we're looking forward to. So Pride Month, Trans Day of Visibility. So again, in your department, you maybe could display something that says it's this. I might be around the hospital doing some promotional work around these things. So again, it doesn't have to be a massive display, but it's just a poster that says this month is LGBT History Month, Disability Pride Month, we've got Bisexual Awareness Week, we've got National Coming Out Day, Bisexual Awareness Week, Trans Awareness Week. So there are quite a lot of promotional days for this, so I'm not expecting you to do all of these. But just promotion of these again, if someone's sitting in your department who might be LGBT plus and sees that poster, they can think, brilliant, this is an inclusive service because they're promoting these LGBTQ plus days. And I know there's probably a million different days connected to different types of characteristics. So I know it's hard to promote everything all the time. So again, part of our role within the network and going to the trust is to try and make sure that visually we know that when people come in, that it's LGBT inclusive. So that's part of our agenda for the network and the Rainbow Badge Assessment. So I think really positively, for the first time, particularly in Luton and Bedfordshire, we've got lots of services available to support LGBTQ plus people. So I think historically it used to be more nightclubs that we had in Luton, so Flame and the Cali. But we know not everyone wants to socialise in a pub or be on that kind of scene. So it's really great to see these services. So you've obviously got Luton Sexual Health. So we're based in Arndale House in the mall in town. So if you have anyone that needs any sexual health support or one-to-one support, you can refer them to us. We have Pride in Luton, who organise Pride, which is I think it's July the 6th this year. And they also do things like social Sundays at the Hat Factory. So just a chance for anyone to come down and mingle, meet new people, talk about sexuality, gender, those sorts of things. We have trans plus admin, which is for over 18. So it's to help trans and non-binary people to look at documents they have to help support write documents and letters to change things like passports, birth certificates. So that's been set up for that. We've got TOCO, which has got an OK to be group, which is for under 18s. So if you have children, if you are working with young people on wards who might need support around LGBT, you can refer them to TOCO. We have LGBT Bedfordshire. So that's more of a social service. So they do walking, they do reading groups, yoga groups. They can support with sexual health. They can support with things like housing and all those sorts of things. And also we have Rainbow Bedfordshire, which is similar. So it's a nice place to go for social activities, to meet new people. So a lot of our clients say they feel quite alone, they feel isolated, they don't know any other trans people or any other gay people. So having all these services locally is fantastic. So probably part of my role here is to probably get these services or posters around the hospital, just promote that so that people know that they're available. We've also got national services that we particularly work with quite a lot. So Stonewall Mermaids is to support families, parents, children who might be trans or non-binary. The Switchboard and the LGBT Foundation are national helplines that anyone who's LGBT plus can call if they want to talk to someone, if they're not out, and maybe just want to talk to someone about how they feel. So I think locally and nationally, we're in a really good place for support network. So I'm really pleased that we've got that in place, and that there's a lot more options for people to sort of tap into and stuff. So that's really good. So I presented this on the 13th of February, so it's just before Valentine's Day. I didn't get to play this video because we had some issues on the day as well. So I'd like to play this to you. So it's called Love is Love and Love Has No Labels. So it's just a really nice video to talk about inclusivity. Again, this hasn't got sound, but it has got captions. definitely the one that I would probably play. And when we look at LGBT plus, LGB is about sexuality. It's about having an attraction to someone physically, emotionally, sexually, which most people have. And when it comes to gender, it's about how comfortable you feel in your gender and how you choose to identify. So LGBT plus people feel the same as anybody else. They just want to be loved. They want to form relationships. They want to be happy. They want to have families. So that for me is probably a really nice video just to show about diversity and inclusion. Yeah, so that was for Valentine's Day. So I hope you all had a nice Valentine's Day. And then just to end really, so there's my contact details. Is that sharing? It's sharing, but it's very small, isn't it? So you can either call me on that number. If you just have a general inquiry, if you use my ldh.nhs.uk one, I haven't changed over to the new one yet. So they'll still come through. Or if you have any information containing a patient, if you use my nhs.net account, just a bit more secure. So I'm more than happy to support you or your department. More than happy to receive referrals for any people that you might be working with. We have social media. So again, if anyone wanted to sort of keep in contact via social media or look at some of the things we do, by all means, please add yourself to that as well. Okay. So I'm gonna come back on. He says, there I am. Lovely. So I really appreciate it's been quite a quick run through for LGBT History Month. I hope it's been useful. And as I said, the network and the trust are going to be working together to put some of those recommendations in place and hopefully aim for that bronze award, which I think we were really, really close to last time. So it'd be really nice to see that. I'm just going to check the chat. Okay. So what I'll do, Lisa, is I'll probably see if we can get this presentation uploaded to the network page on the intranet so that you can increase the size of the writing. And also what I put on the intranet is the links to the videos so that you can hear them with sound and those sorts of things. Okay, so we've got the funding. Okay, yeah. So there are still things that we can do as part of the network and the trust to do that. So that'll be part of our agenda, I think, probably moving forwards. Thanks, Ange. Has anyone got any questions? No. So I just want to say a lot of the feedback was really positive. So, thank you for, working really hard, making sure that not just our LGBT plus, but that's really important, but all patients that come into the hospital, all visitors come in, feel safe. They feel included, they feel listened to, they feel respected. And like I said, I think locally as a whole, we are really, really good at our LGBT plus inclusivity. So thank you all. Like I said, I'll upload this onto the intranet. It's under Staff Networks. This has also been recorded, so if you want to share this with some of your work colleagues as well, that'd be great. And like I said, if you'd like to contact me, please do. I'm really passionate about LGBT plus. I'm really an advocate for people. So really passionate about my role. So yeah, if you'd like any support, then I'm really passionate about LGBT plus. I'm really an advocate for people. So really passionate about my role. So yeah, if you'd like any support, then please contact me. Any other questions from anybody on the call? No, brilliant. Lovely. Thank you all for your time. Have a good rest of your day, and hopefully we'll speak soon.